have been living with HIV for almost 2 decades, and I have been on the treatment since then. And I found out through testing when I went to the clinic, to the hospital.
A UNICEF report in 2021 states that Nigeria has the highest number of children living with HIV in West Africa and Central Africa, with estimates up to 190,000. The UNICEF report states that in Nigeria, 20,695 children aged 0 to 9 years were newly infected with HIV in 2020, or one child every 30 minutes.
Executive orders, presidential memoranda, and others.
Reports say the United States of America accounts for 80% of AIDS treatment to vulnerable populations in low- and middle-income countries. But the recent notice to all diplomatic and consular officials halting all U.S. global health assistance, including the President's Emergency Plan for AIDS Relief, or PEPFAR, has been described as a wake-up call in Africa, especially Nigeria. Even though the decision was later waived, as later announced by the U.S. Secretary of State, Marco Rubio, many health experts, patients and observers are asking what's next for low-income countries.
If the fund has stopped, I think we don't have any hope. And I'm telling you, if that spot is not there, I don't even think what will happen, because people cannot afford it. I don't know how much they are selling it, but I don't think any one of us can afford it.
Many say the hope of thousands of people living with HIV like Fatima hangs in the balance if the U.S. holds HIV treatment in the near future. But is Nigeria ready for self-sufficiency?
Since the inception of PEPFAR 2004, the U.S. government has spent almost $6.5 billion on, the HIV response here. Since 2010, there's been that push for ownership and sustainability. That's where we really can make an impact in terms of, yes. If we recall, Nigeria was actually the first country to start procuring drugs for people who have HIV. This was 2002 by President Olusegun Obasanjo. And we couldn't really, move fast to ensure that all our patients are on the Nigerian drugs. So when PEPFAR came, assimilated all of them. I always say that HIV is transmitted at the level of community, and therefore it is at those communities that we need to work hardest to ensure that we can interrupt transmission.
The network of people living with HIV/AIDS in Nigeria expresses confidence that Nigeria is capable of handling the HIV treatment for its affected populace.
It will impact slightly on our program in terms of engagement, putting people monitoring, but as per the ARV consumption, treatment itself, I don't think within that 3 months will be a challenge or a problem for Nigeria. The reason being that we have stock, we have commodities, and in fact, even prior to this period, I know we have a buffer where drugs have been procured under the central procurement that we used to do for the country.
Nigeria's Health Minister Mohammed Ali Pate speaks with Arise News about self-sufficiency being the key driver in the provision of HIV treatment for infected patients.
Can you tell us, what was your first reaction when you heard about the Trump's executive order?
The policy direction that the U.S. government is announcing is an opportunity for reset, for us to step back and see how do we ensure that those who are getting treatment will continue to get the treatment that they need. How do we ensure that we also produce the commodities that we need to take care of them? Private sector can invest in Nigeria, and there are Nigerian private sector partners that can work with them so that we produce what we need to ensure there is sustainability.
The minister emphasizes plans to bridge any emergency gaps in the health sector.
Nigeria's health sector is increasing its resiliency, and the direction of the U.S. administration that has been announced is not too far in terms of disconnecting with the direction of the sector-wide approach. As far as we can see, the new U.S. policy direction is not too far disconnected And we expect after the review that is on the way, that we'll find a common ground that addresses the U.S. national interest, but importantly for us, also is compatible with Nigeria's national interest.
As a step-up and precautionary measure, the Nigerian government during the week approved 4.8 billion naira for the procurement of 150,000 HIV treatment packs over the next 4 months. Health experts suggest that state governments need to begin to take accountability for its citizens by catering to people living with the virus. Also, the Abuja Declaration 2010 requires 15% of the national budget to cater for healthcare. This, if implemented, will close such gaps in the healthcare system. Oli J. Wapera, Arise News.